Hello everybody. I'm Dr. Shrikant Shetty, Senior Consultant and Head of Cardiology at Sakra World Hospital. There is an epidemic of obesity in our country and in the world as a whole. This is a particular problem for India where there is an epidemic of diabetes along with obesity, what we call diabesity. So we are going through an epidemic of diabesity where a large population is suffering from diabetes and overweight. When we speak about overweight and obesity, all people are not the same. There is a particular pattern of obesity that is associated with a higher risk of developing metabolic disorders like diabetes, high cholesterol, high blood pressure, and therefore coronary artery disease. This is what we call the abdominal obesity. It is a peculiar phenotype that we see in our country, both amongst men and women, where there is concentration of fat around the abdomen. So how do we identify that the fat is concentrated primarily around the abdomen? This is by measuring the waist circumference and by using what is called a waist-hip ratio. The waist-hip ratio is considered to be a better predictor of heart diseases as compared to general obesity, which is measured by what is called body mass index. Interestingly, the cutoff for normal body mass index, normal waist circumference, and normal waist-hip ratio for Indian men and women are much lower than what are recommended for the Caucasians, the Western population, which means that we are expected to be much leaner than our European and American counterparts. For example, the normal body mass index for Indians is recommended as 23 kg per meter square, which means we are expected to be much leaner than our American counterparts. Likewise, the waist circumference that is considered to be normal for Indian women is 80 centimeter and for Indian men is 85 centimeter, whereas it is 90 centimeters for Caucasian men and 85 centimeter for Caucasian women. Likewise, the normal waist-hip ratio for Indian men is 0.88, whereas it is 0.81 for Indian women, which means we have to work hard to ensure that we do not develop abdominal obesity.